Hi everyone, welcome back to Graduate Medical Education Mondays. This week I wanted to jump on and tell you about an article that I came across. It is titled The 60-Minute Root Cause Analysis, a workshop to engage interdisciplinary clinicians in quality improvement. And I actually came across the article through one of the presentations at the ACGME's annual conference, and it was the name of the presentation was GME and the Patient Care Dream Team, and it was a panel-like discussion. There were multiple presenters with varying roles in graduate medical education, and one of the presenters was a critical care fellow from Boston, a Dr. Swami, who kind of got up there and talked to the audience about his experience and journey in quality improvement and patient safety, which kind of led to some of the work that he does now and how he became, I think, so passionate about quality and patient safety. So he is one of the main contributing authors of the article, as well as one of the main people who helped to establish this workshop. It sounds like along with some other residents that were in his program at the same time, and some other healthcare professionals as well. So what's really great about the article is that I think a lot of programs and institutions can really benefit from the content and what they put together and being able to implement it in your own institutions. So what they really did was they created a standardized method in order to engage residents in quality improvement, and they used the root cause analysis method. So I think a lot of institutions and programs kind of struggle with the experiential learning piece of quality improvement and patient safety and putting some of the methodologies into practice and actually using them. We're really good at least at this point, I think in my experience, at the didactic piece of the quality improvement and patient safety education, but I think still some work to do on that experiential piece and kind of learning, in practice. So this was really good because this is something that you could implement and you could get all of your residents exposed to root cause analysis, and not just ones that happen to be part of a real event at your institution in which an RCA is conducted, which I think is what happens at a lot of institutions, that residents are really only involved if they happen to be or if they happen to be part of the case that an event was reported on. And then, subsequently an RCA completed. So this was great because it does engage all residents and fellows. The other thing that's really great that programs and institutions will benefit from is the article really lays out a process and a methodology for how they conducted the workshop, to identifying the roles of the people involved, identifying the work to be done prior to the workshop, how to actually conduct the workshop. It really lays the foundation so you don't have to kind of reinvent the wheel. And I think the best part is that they actually provide cases for you that you can use. So if you read through it and decide that you want to implement something similar at your own institution, but you're not sure kind of where to start, what cases to pull, you don't have time to go through your event reporting system, whatever the case may be, you can start with one of the 3 cases that they provide as part of the content of the article, which I think is great. As they talk about in the article, I think it definitely has more meaning in order to be able to choose an event that actually happened at your institution. It may be a little bit more relatable, and the residents may have a little bit better understanding, only because it's something that actually happened at your own institution. But it's certainly not necessary in order to really just get the residents involved in actually conducting RCAs and what the process is. So I just wanted to share that with everybody. Please go and pull the article and take a look at it. It's rather short. It's got great content. I thank the authors for what they have put together and for sharing it with a larger GME community. I think it's great. And that's it for this week. I'll see you guys next week. Bye.